Hi, my name is Angel, and this is going to be a lecture on human anatomy, facial muscles, right? So we are going to start our first chapter, and eventually we'll start covering each and every muscle in the body, right? So this is going to be for facial muscles only, and this is provided by Angel Loves Human Medicine, all right? All right, so as you can see, this is a cadaver, right? This is a right lateral deep view of the cadaver. Here we have Occipitofrontalis, frontal belly. This is Orbicularis oculi. This is Nasalis. This is Zygomaticus major. This is masseter. Your masseter is very important for chewing. This is Buccinator, right? As you can see right here. This is Depressor anguli oris. This is Stylohyoid. This is digastric anterior belly. This is inferior pharyngeal constrictor, right? This is sternohyoid. Okay, this is stylohyoid. This is digastric posterior belly. What we saw here was the anterior belly right here. This is posterior auricular, right? We have three muscles, auricular muscles. This is occipitofrontalis, the occipital belly right here. This is temporalis, right? This part is temporalis. Epicranial aponeurosis. This is epicranial aponeurosis. So this is a cadaveric image, and going forward, we'll see a lot of animated images. All right, so muscles are very important. Facial muscles work together to control parts of our face. They're essential to chewing, right, masticating, and making facial expressions. You know, an expressionless face looks real bad. You know, it's important to smile, to say hello, bye, you know, to frown a little, look sad, upset. That is also an emotion. If you experience weakness or paralysis in your face muscles, seek medical attention, right? Because if you are paralyzed somewhere, it kind of shows that either it is your cranial nerve that's damaged, and or you're having some serious issue. It may be due to infection. It can also be due to damage or injury, right? So although facial palsy can be a sign of temporary curable condition, it may also indicate a serious medical problem, right? It happens at times. We may also have issue, let's say a joint dysfunction, which I had once. I had a temporomandibular joint dysfunction where I could not open my mouth nor close my mouth. So now that becomes a little skeletal condition more than the muscular condition, right? So it depends on why you're having trouble. But muscles itself are very important, because without muscles, we end up looking like this, and this is like really scary. Introduction to facial muscles. The facial muscles are a group of striated skeletal muscles, right? We have cardiac muscles, we have striated muscles, we also have smooth muscles, voluntary, involuntary muscles, right? So somewhere I feel that facial muscles are a group of striated skeletal muscles supplied by the facial nerve, the cranial seventh nerve, that among other things control facial expressions, right? So cranial seventh nerve is the main, the facial nerve that provides most of the innervations for all the muscles. These muscles are also called mimetic muscles, right? We know something called mimes, right? When you go to Paris, you'll see a lot of mimes, and they'll make all sorts of face, right? That's why they're called as mimetic muscles, because they're responsible for expressions. They're only found in mammals, which is true, although they derive from neural crest cells found in all vertebrates, right? But mostly it's in mammals. And they are the only muscles that attach to the dermis, to our skin. The facial muscles are just under the skin subcutaneous muscles that control facial expressions. They generally originate from surface of the skull bone, rarely the fascia, and insert on the skin of the face, right? So it gets inserted on the skin of the face, originates from the skull bone. When they contract, the skin moves, right? So when we do this, that's our skin moving. That's because of muscles contracting or expanding, like that. These muscles are also cause wrinkles at right angles to the muscles action line. So whenever there is like a cross street, there will be some wrinkles. You see this? Wrinkles. Wrinkles. Okay. So facial muscles can also cause some serious wrinkles. Nerve supply. The facial muscles are supplied by facial nerve, cranial 7, with each nerve serving one side of the face. So each nerve serves one side of the face, right? In contrast, the nearby masticatory muscles are supplied by mandibular nerve. This is the mandible, a branch of trigeminal nerve, cranial number 4. The facial muscles are derived from the second branchial pharyngeal arch. They, like the branchial arches, originally derived from neural crest cells. In humans, they typically begin forming around the 8th week of embryonic development, so 3 to 8 weeks. So it starts at 8th week, right, during the embryonic development. So when you're in the mother's womb in your 8th week, sometimes you start developing the facial muscles. What is the clinical significance? Why do we have facial muscles? And inability to form facial expression on one side of the face may be the first sign of damage to the nerve of these muscles, right? It's a clinical significance. Damage to the facial nerve results in facial paralysis of the muscles of facial expression on the involved side, right? I have personally seen many patients where they cannot actually move the muscles right here, and they will go like that, and they will also have saliva dripping, because they don't really have control over anything inside the mouth. Paralysis is the loss of voluntary muscle action. The facial nerve has become damaged permanently or temporarily, right? This damage can occur with a stroke, right? Bell palsy or parotid salivary gland, right? Parotid salivary gland right here. Cancer, malignant neoplasm. Because the facial nerve travels through the gland. The facial nerve is traveling through the gland. So if you have a parotid gland right here, if it's traveling and you have paralysis, then that's what will happen. You'll be like, and you'll have saliva dripping. The parotid gland can also be damaged permanently by surgery or, sorry, I guess I missed it, or by any infection. If you have an infection and it goes really bad, then it may cause some damage or paralysis. I remember I had cellulitis, and trust me, the whole area was hurting so bad. I did not have numbness, but I did get a gum infection because of it. And that's how it actually spread. And I could actually feel that my face was swollen, and it was getting slowly and gradually swollen and red. Okay, and it happened because I'm allergic to Febreze, the air freshener. Alright, so let's start with the muscles of the face. Occipitofrontalis muscle. So as you can see right here, this is the frontalis muscle. This part is the frontalis, frontal belly, frontalis, skin of eyebrow, right? So that's where the origin is, the skin of eyebrow. Muscles of the forehead, occipital, belly, occipitalis, lateral 2/3 of superior nuchal line. Okay, so this is where it starts. Muscles of the forehead, occipital belly, frontal belly, right? Insertion epicranial aponeurosis. Epicranial aponeurosis is where it's, the insertion is, right? As you can see in this picture. The frontal belly of occipitofrontalis, and this is epicranial aponeurosis. Frontal belly elevates eyebrows, wrinkles, skin of forehead. Occipital belly retracts scalp, or so like that, right? Innervation, frontal belly, temporal branches of facial nerve, CN7. Occipital belly, posterior auricular nerve, branch of facial, CN8. Superficial, temporal, ophthalmic, posterior, auricular, and occipital arteries. There are multiple arteries providing blood supply to the occipitofrontalis muscle. And aponeurosis is essentially a thick fascia that connects two muscle bellies. This epicranial aponeurosis connects the muscle bellies of the occipitalis and frontalis to form one muscle, the occipitofrontalis. Okay, so they come together and just form one muscle, occipitofrontalis, right? So imagine not having a muscle here, then you only have a skull, so you cannot feel any cushion, right? So muscles are important, especially they provide cushion, they provide a little bit of insulation, and also they help you do this, right? Like this. Temporoparietalis muscle. These are the temporal lobes, right? Where we wear our headphones right here. Temporal fossa up to inferior temporal line, temporal fascia. So this is it. So this is the temporal above the ear right here. Insertion is apex and medial surface of coronoid process. The coronoid process, this part of the mandible. Whenever you do this, you'll kind of feel a little bit of hitch here too. Why? Because you're try doing and you'll feel a click right here. Okay. The action anterior fibers elevates mandible. Alright. And posterior part retracts mandible. Like that. Okay. So deep temporal branches of mandibular nerve, right? So they usually are innervated by the mandibular nerve. Here, mandibular nerve. Blood supply, deep temporal branch of maxillary artery, middle temporal branches from the superficial temporal artery. So, you know, there are multiple blood supply providing arteries, you know, for the temporoparietalis muscle. Procerus muscle. This part is the procerus muscle like this. You see this? This part is procerus muscle. As you can see, my wrinkles right here. Nasal bones, superior part of lateral nasal cartilage, right? So this is a superior part of nasal cartilage. Skin of glabella. This area, middle of the eyebrows, is called glabella. The skin of glabella, that's where the insertion is. Like I said, muscles also connect from the skull to the skin of, you know, your skin, like your facial skin. Fibers of frontal belly to occipitofrontalis muscle. So many times, you know, you will see that your facial muscles are also connected to a different muscle through a fiber. And this is exactly why a lot many doctors are like, why don't you eat collagen to make sure your skin's very stretchy and it looks very young. This is exactly why, right? Because you'll see a lot many muscles that are connected to each other. All right. Action depresses medial end of the eyebrow, wrinkle skin of glabella. You know, like that, right here, this area. So innovation, temporal lower zygomatic or buccal branches of facial nerve, blood supply, angular and lateral nasal branches of facial arteries, the angular and lateral branches, nasal branches of facial artery. Okay, let's talk about nasalis muscle. Okay, this is actually my favorite muscle because I usually have a lot of tissue around this area. All right, origin, alar part. This is the alar part. Frontal process of maxilla, frontal process of maxilla, to lateral incisor, transverse part maxilla, superolateral to incisor foramen. Insertion, alar part, skin of alar. Transfer far merges with the counterpart at the dorsum of the nose. Dorsum of the nose. This is nasalis pyramidalis. I'm not covering it in this video, but this particular, you know, this shiny thing, nasalis pyramidalis. Alright, so alar part depresses alar laterally, dilates nostrils, right? Very important to have dilated nostrils. Transverse part, wrinkle skin of dorsum of the nose. Yeah, so that's the nose, you know. Buccal branch of facial nerve. Okay, so that's the buccal branch of facial. Superior labial, septal, and lateral nasal branches of facial artery, infraorbital branch of maxillary artery. The multiple arteries providing blood supply. Okay, this is exactly why a lot many people, when they get a plastic surgery, they get a nose job, they would actually take a cartilage from your ear, connect it to your nasal bone, nasalis, and then they work on connecting the nasalis muscle. Right, so that's what. But they also have to be very careful because, as you can see, there are so many arteries providing the blood supply. So it may look like a very easy surgery, but it is a very complicated surgery because you're kind of working on very small surface area. You don't really have a larger surface area. Depressor septi nasi muscle. Okay, so this is more like, you know, those little mustaches that I believe Charlie Chaplin had. So you can remember it by that. Depressor septi nasi muscle. Attachments originates from the maxilla above the medial incisor tooth. And inserts onto the nasal septum. This is the nasal, it inserts. Pulls the nasal septum inferiorly to widen the nasal opening. So what it kind of does is pulls the nasal septum inferior to widen the nasal opening, right? So a lot many of us have small nostrils. As you can see, I have small nostrils. So if I want to do something, I want to, you know, put like a little nasal drops, I have to do this, right? And a lot many girls, they know that when you get waxing on your upper lip, sometimes you have to create more space, or you have to do that. Why? Because when you're like this, then you may not be able to do the waxing. So this is a different type of action, right? So it pulls the nasal septum inferiorly to widen the nasal opening. At times you also do that. We want to clean the nose. So opening is very important. So this particular, although it looks like it's a small one, it's a still important one. Buccal branch is a facial nerve, innervates depressor septi, nasi muscle. Whenever you see something that is around this area, by default understand it is innervated by buccal branch is a facial nerve. Blood supplies by facial artery. Trust me, most of the facial muscles are going to be supplied by facial artery. Orbicularis oculi muscle, alright? So this part is orbicularis oculi muscle. Nasal part of frontal bone connects with the frontal process of maxilla. Medial palpebral ligament, right? Lacrimal bone. So that's where the origin is. Nasal part of frontal bone, frontal process of maxilla, medial palpebral ligament, and lacrimal bone. Insertion, skin of orbital region, lateral palpebral raphe, superior inferior tarsal plates. The skin of orbital region, lateral and palpebral raphe. Superior inferior tarsal plates. Superior inferior tarsal plates. Actions, closes eyelids tightly, very important. Palpebral part, closes eyelids gently. When you try to close your eyes very tightly, that's when you'll see there is an orbital part, or like orbital, the complete orbits that are trying to close your eyes. The palpebral part would be like here, like this. It's not the orbital part. Deep bulbar compresses lacrimal sac. Okay, so sometimes we can actually do that. So deep palpebral part compresses lacrimal sac. Innervation, temporal and zygomatic branches of facial nerves 7. All right. A blood supply, maxillary, superficial, temporal, facial, ophthalmic arteries. Palpebral fascia. So this is the palpebral fascia. Palpebral fissure is inside right here. Whitnell's tubercle is right here. That's a Whitnell's tubercle. Lateral palpebral ligament on the corner. Inferior tarsal plate right here. Medial palpebral ligament right here. Okay. Lacrimal fossa in the medial wall of the bony orbit. Okay, so that's the lacrimal fossa. Superior tarsal, when you close your eyes, where you put your eye makeup right here. So that's superior tarsal plate because it's flat. Levator palpebral superiors. So this, when you do this, that's a levator right there. Okay. Corrugator supercilii muscle, medial end of superciliary arches, fibers of orbicularis oculi muscle. So, right here where you have your eyebrows like this. Skin above middle of supraorbital margin is the insertion. Function creates vertical wrinkles over glabella. So this is your glabella. It creates vertical wrinkles, or like that. Temporal branch is a facial nerve, CN7. Blood supply, ophthalmic artery, superficial temporal artery. Depressor, supercilii muscle, so right here, like this. Okay, so medial orbital rim, that's the origin, medial orbital rim. Insertion, medial aspect of bony orbit. What's the nerve? The nerve name is facial nerve. Actions, depression of the eyebrow. Branches of the facial artery, branch of external carotid artery. Branches of the facial artery, that's the, most of the times you'll see that most of the facial muscles are, the main blood supplier is the facial artery. Auricular muscles, these are the muscles on right behind our ears, posterior to our ears. Okay, so origin, temporal fascia, this is the temporal fascia. Insertions, major helix, the ear, right? Actions, pulls ear forward, right? I have a really hard time pulling my ear forward, but some people can. Some people can do it. I can do it. Okay, so you can try doing it if you can. Chances are auricular muscles are the ones that will be helping you do it. Temporal branch of facial nerve, innervation. The blood supply is superficial temporal artery. All right, so this little process that you can see here in blue, that's the mastoid process. The posterior auricular muscle, right? So there are 3 auricular. One is anterior, as you can see right here. One superior. Up is superior. Posterior is back. Anterior is front. right? So origin maxillary process of temporal bone, insertion, posterior part of auricle of outer ear, actions pulls ear backward, the posterior will pull backward, the anterior will pull it forward, right? Posterior auricular nerve of the facial nerve, right? So innervation is posterior auricular nerve. For anterior, it is temporal branch of facial nerve. Blood supply is posterior auricular artery. Superior auricular muscle origin is temporal fascia. Insertion above the auricle of the outer ear. Actions pulls ears upward. I cannot pull it upward, but you can try. And if that happens, then chances are it is the superior auricular muscle that's helping you. Innervation branches to auricular muscle, posterior auricular nerve, a cranial CN7. Blood supply, posterior auricular artery. Okay. Orbicularis oris muscle arises from the maxilla and from the other muscles of the cheek. Insertion, it inserts onto the skin and mucous membrane of the lips, right? As you can see, this is the orbicularis oris, this vertical muscle, okay? Buccal branches of facial nerve are innervating it, right? We saw that there was another vertical muscle around this area that was also innervated by buccal branch of facial nerve. Action, it closes the lips to narrow the oral opening. Like that. Superior inferior labial branches of facial artery provide the blood supply. Superior, inferior, because that's right here, right? Like that. Okay. Depressor anguli oris muscle. The mental tubercle oblique line of mandible continuous with platysma muscle. These muscles are platysma, they go like that, right? So that's the mental tubercle and oblique line of mandible continuous with platysma muscles. Insertion is modulus, right? Function, depresses angle of mouth, right? Depressor anguli oris. Oris is oral, that's mouth, right? So anguli, so it gives an angle. So that's the wide open muscle. Buccal and mandibular branches of facial nerve CN7, right? So because we're also using our mandibular, that's why we are calling it buccal and mandibular branches of facial CN7. Like that. Depressor. Inferior labial artery, facial artery, mental artery, maxillary artery. So, you know, there are two blood supplying facial artery and maxillary artery. Risorius, parotid fascia, buccal skin, zygomatic bone, origin, okay, parotid fascia, right here, parotid fascia, because that's where the parotid gland is. Insertion is modulus. Function, actions, angle of mouth laterally. So this is what they do laterally. Okay. Buccal branch of facial nerve, right? Anything that is around this area is usually innervated by the buccal branch. Blood supply, superior labial artery, facial artery. So superior labial artery is, you know, anything that's right here will be blood. The blood supply would be the superior labial artery. That's a facial artery. Zygomaticus, major muscle, posterior part of lateral aspect of zygomatic bone. Insertion is modulus, blends with muscles of the upper lip, right? As you can see, this upper lip and it's going right like this, the green line. And that's why it's called as major. Why? Because it's really long. It's major, right? It's not minor, it's major. Okay, the functions elevates and everts angle of mouth. So what are we doing? We're using a major muscle to do it. And usually it's done for, you know, opening the mouth wide open. Like that. Okay. Innervation buccal and zygomatic branches of facial nerve CN7, blood supply, superior labial artery, facial nerve artery. So its blood supplier is facial artery. Now this is the minor muscle, Zygomaticus minor muscle. Lateral aspect of zygomatic bone. Insertion blends with muscles of the upper lip. Action elevates upper lip, exposes maxillary teeth. Innervation zygomatic and buccal branches of facial nerve. Blood supply, superior labial branch of the facial artery. Levator, labii, superioris. Okay, so origin is zygomatic process of maxilla. Maxillary process of zygomatic bone. Insertion blends with muscles of upper lip. Action elevates upper lip, exposes maxillary teeth. Okay, so action is elevates upper lip, right? I kind of have a really hard time elevating it, but it elevates the upper lip, exposes and maxillary like this, like that. Okay. Zygomatic and buccal branches of facial nerve. Blood supply, facial artery, infraorbital branch of maxillary artery. Levator, labii, superioris, right? So this is labii, levator is right here. Superioris because it's on in this area, right? Like that. Levator, labii, superioris, alaeque, nasi muscle. So this alaeque nasi muscle. Nasal bone. Insertion nostril and upper lip, right? Insertion is nostril and upper lip. The buccal branch of facial nerve, and the buccal branch right here. Facial nerve. Action dilates the nostril, elevates the upper lip, and wing of the nose. Like that. The blood supplier is facial artery. Depressor labii inferioris muscle. Oblique line of mandible continues with platysma muscle, right? The oblique line. So this like this. Alright. Depresses lower lip inferior laterally. Mandibular branch of facial nerve. Inferior labial branch of facial artery. Mental branch of maxillary artery. Levator anguli oris. So right here. It's a little small muscle right here. Canine fossa of maxilla. Canine right here. Right? So right here. Canine fossa. There's a little fossa right here, and that's where it connects inside. Alright. Elevates angle of mouth. That's right, right? When we elevate the angle of mouth, we need help of this internal muscle. Elevates angle of mouth. Zygomatic and buccal branches of CN7. Blood supply, superior labial branch of facial artery, infraorbital branch of maxillary artery. Buccinator muscle, superior part alveolar process of maxilla, inferior part alveolar part of mandible, posterior part pterygomandibular raphe, buccinator crest of mandible. Okay, so there are multiple originations, superior part, inferior part, and posterior part. Insertion modiolus blends with muscles of upper lip. Function compresses cheek against molar teeth. Innervation buccal branch of facial nerve CN7. Blood supply buccal artery, maxillary artery, and facial artery. So buccal branch of facial nerve is the innervation. Compresses cheek against a molar teeth. Like that. Mentalis, this is the mentalis, just two, mentalis. Incisive fossa of mandible, skin of chin, mentolabial sulcus. Action elevates, everts, and protrudes lower lip, wrinkles the skin of chin. As you can see, the wrinkles. Mandibular branch of facial nerve. Blood supply, inferior labial branch of facial artery, mental branch of maxillary artery. Platysma. What is platysma? Platysma is a flat plate, right? This is like a new Latin word. Literally something wide and flat. Skin fascia of inferior supraclavicular regions, right? So skin fascia of infra and supraclavicular regions. Insertion lower border of mandible. Skin of buccal cheek region. Lower lip modulus. Orbicularis oris muscle, all right? Innervation cervical branch of facial nerve, CN7. Submental artery, facial artery, supraclavicular artery, tyrocervical trunk. Actions depresses mandible and angle of mouth, tense skin of lower face and anterior neck. So it depresses the mandible and angle of the mouth, right? Like that. Tenses skin of lower face, right? Whenever you do that, you will feel that you're tensing skin of lower face right here. And anterior neck, so this. So you're increasing tension. So that's when, when you have double chin, this is what they say, right? do it. So increase a little tension. So what will happen is you loosen a little bit of weight right here. So you let go of double chin, right? So that's Platysma, which is like a flat plate right here. And that's why they're saying it connects with supraclavicular regions. This is a clavicle, supraclavicular regions. Stylohyoid muscle. Styloid process of temporal bone is the origin of stylohyoid muscle. Insertions body of hyoid bone. Action elevates and draws hyoid bone posteriorly. Innervation stylohyoid branch of facial nerve. Blood supply branches from the facial occipital and posterior auricular nerve arteries. So that's the blood supplier. Alright, so that's it about facial nerve. I'll be back with another video of different muscles or different part of the body. Until then, please like, comment, share, and subscribe. Bye.